Hey guys, it's Jen again. I got the house to myself today, so I'm kind of bombarding you a little bit with videos, but you know, it's hard to catch a free moment in my home. And I was just watching a video from Alynn, who has surgery tomorrow, and she voiced some concern about the Ontario healthcare system. And I just wanted to pop on and do a quick update. First and foremost, Alynn, good luck tomorrow. I hope that everything goes super well. You're treated with great dignity and respect. The nursing staff takes good care of you, and the doctors take good care of you. I'm sure everything will be fine. But I did want to talk a little bit about Ontario healthcare. For Americans, Ontario has universal healthcare, which means that insurance or no insurance, you get healthcare. There's pros and cons to it. In the States, Alynn is correct. Hospitals, doctors, what have you, are treated as a business. They want your return business, so they treat you well. That's not to say that Ontario nurses and doctors treat you poorly, per se. It just means that they're more bombarded with patients, and it's a government agency. So, you know, there's a little bit of chaos that comes with every government agency. If you think about the DMV, kind of the same, on the same wavelength. It is a government job. Having said that, you need to, and as I'm sure Alynn has discovered in the last year and a bit that she's been going through all this process, you need to advocate for yourself. You can't be afraid to ask for what you need. They're not going to come running to you with everything you need. They're not going to spend the time to anticipate what you're going to need. You need to ask for it. So, and that goes beforehand, Alynn, as you've obviously already seen. It's also going to be apparent at the hospital that you need to advocate for yourself, and at times it's good to have somebody to advocate for you if you can't, to help make decisions, to keep their eye on things like allergies. You do have a file, and anything like allergies or what have you is on that file. Sometimes the nurses are very busy, and sometimes they don't pay great attention to that kind of stuff. So it's good to have somebody who's there to advocate for you if you can't, and to make sure that, you know, you're not being fed or given something that can cause you any harm. Now, having said all that, the nursing staff at Toronto Western Hospital, as I understand, are some of the best. And I believe, you know, I have some friends that are nurses and what have you. I believe that they have your best intentions at heart for the most part. I do think that they care. But I also think that, you know, for them, it's a job, and it can be a little aggravating to watch, you know, when you ask a nurse for something or a doctor for something and they don't hop right on it. To you and your family, you are patient number 1. To the nursing staff, you may be patient number 3 or 4. They may have somebody who's more critical than you are, or needs something a little more quickly than you do, so they may not jump to your aid right away. Having said that, if you do need something that's urgent and you need it right away, it's good to have somebody there to advocate for you and to be the one to run out to the nurse's station and say, no, not later, now. It's good to have that. So, anywho, I just want to keep this one very quick and brief. There are some frustrations with the Ontario healthcare, but you're there, Alynn, you're there. Tomorrow's the day. Good luck. I wish you the best of luck again, and I will be watching for your update afterwards. I hope everything goes really well. Anyways, take care. Good luck.